If you can teach a child at a very early age how to properly brush, that child will brush properly the whole rest of their life, and they will eliminate 90% of all bacterially caused gum disease, decay, cavities. It's a very easy thing to teach. You need a couple of caveats here. That's you start early, you get a little stool, you get little toothbrushes, you use one, they use one, they brush their teeth, they check your teeth with your toothbrush, you check their teeth with their toothbrush, and within a very short period of time, they will brush better than 90% of the rest of the world, probably 98% of the rest of the world. And their bacterial-caused dental disease will be easily 90% prevented for the rest of their life. Okay? Then you throw in cleaning in between the teeth when they get older, and we have favorite ways of doing that don't involve flossing, that are much more effective, much quicker, much easier to do, much easier to teach. And those are the micro bottle brushes. Various companies make them, but once you start doing that, it's hard to go back to flossing because you actually feel better. And everybody wants to use a water pick and wants to use a jiggler and wants to use, mouthwash. But the fact of the matter is, they're just trying to get white yogurt off a plate. And all you have to do is just gently touch it and the plaque comes off. Now, it always comes back, but if you take it off all the surfaces, this imaginary pencil line around each tooth, at the gum line on the tooth, so where the tissue comes in contact with the tooth, they call that the shoreline. Well, you have to keep the shoreline clean on the tooth, or this imaginary pencil line, or this gasket clean every day, and then you don't get inflammatory disease. Inflammatory disease is gum disease. Okay? So if you learn how to do that at 2, 3, or 4, you're in very good hands the whole rest of your life. It takes a parent that understands it's communicable. It takes a parent that understands how to do it and how to evaluate it. It takes a parent that understands that they're the ones that transfer the disease bacteria to their children. Thank you for listening. There are other videos on some of these other issues. Thank you.